Well, the Department of Health and Human Services has announced several initiatives to try to reduce reliance on animal testing and drug development. So here to tell us all about them is 90 medical expert Dr. Kohli. Thank you, Dr. Kohli. I know a lot of people are talking about this online today.
What an important discussion.
Yeah, well, historically, animals have been used for years and years and years. Let's talk about why that is.
So when it comes to the lab, guys, it really helps to have an animal model because they tend to get the same diseases that humans get, but their lifespan's a lot shorter. So it's a lot easier to study them, and you can control the environment. And I was actually surprised to see the statistic put out by the FDA that for some clinical drugs that come into development, they use an average of 144 monkeys per drug that comes out into market. So we really can replicate the same experiment over and over again in these animal models, and that's one of the reasons we've used them so commonly.
So why the change now, would you say?
Well, I will say it's timely, and I do want to applaud the administration for doing this because I do think it's time to start thinking about it. Now, you can't throw the baby out with the bathwater overnight and get rid of animal testing, but I think a big driver of the change is the Trump's Make America Great Again initiative, right? The president is leading this, the FDA and DHS have followed. So they've changed policy, they've changed regulations. So up until 2022, you had to have animal testing in order to get a drug approved. Now that's called the Modernization Act, they've removed that. And they've also said now that we have all these new technologies, and that's the second piece of this is the new technologies that have come, why don't we do smarter, better, faster, and potentially more accurate testing in the lab rather than on animals?
We have done it this way for so long. I mean, just playing devil's advocate a little bit, is there concern to not have that level of, testing happening?
To be entirely honest, I'm a little concerned, right? Because we're opening the floodgates of technology without validating that technology. And yes, we have different technologies. So one is called organoids, where you grow the little organ in a petri dish and see how it responds. One is called organ on a chip, where you take this little micro device that's like a computer device that has organ cells in it and then predicts how the organ responds. And then the third is, of course, AI and simulations. But that doesn't replicate the complex biology that is our body. And so I don't think it can explain everything, and I think we have to know where to apply it appropriately. Because let's say we bring a drug into the market using organoids or using organ on a chip, AI simulations, and then it behaves completely differently in the population. You can talk about significant morbidity and mortality from something like that.
Is there any accuracy with some of those methods that you described, or is it too early to tell?
No, in fact, some of them are performing better than the animal models perform. So, because animals and humans at the end of the day are different. For example, a rat's thyroid is very different from our thyroid, whereas if they take a human's thyroid and grow that, maybe it'll perform better. We're also thinking we could maybe personalize medicine a little bit more. So test specific drugs in Black patients, test them in Asian patients, right? Using those types of organ-specific cell lines derived from those populations rather than just a generic animal model. So I think there's some signals for accuracy, there's some concern for validation and regulation, but if we are going to let the floodgates open, we have to make sure we're watching really carefully, regulating, and making sure we're doing a lot of post-marketing surveillance. Now, they're hoping that this will usher in lower costs and drugs can get to market faster. And the other thing they're doing, which I really admire, is that if the drug is marketed in Europe and it's shown to be safe, why do we have to replicate that here in the US? Whereas previously that used to be a requirement. Okay, well, we have to have our own studies in order to prove it. So I'll be interested to see where the future heads, but I don't think it's the end of animal testing. I just think it's time to start phasing it out, adding complementary methods, but there's still a role for it for some diseases.
Makes sense. Yeah. All right, good information, Dr. Kohli. Thank you.